Hello, health enthusiasts, and welcome to Rev Up Health, your go-to podcast for all things wellness. I'm Dr. Mark Heckler.
And I'm Tandi Heckler. Together, we're here to fuel your health journey with the best of functional medicine and holistic well-being.
Each episode will dive deep into topics that matter to your health, bringing you the latest insights, research, and inspiring stories.
So whether you're on a quest for vibrant health or just looking for daily health tips, we've got you covered.
So let's embark on this journey together and transform the way you live. So Tandi, what's on our wellness radar for today?
Hello, and welcome to the Rev Up Health podcast. We are so glad you're here. And I'm Tandi.
And I'm Dr. Mark.
And today we are going to talk about family medical history. And our question for you is, if you were to go to the doctor today and they asked for your family medical history, how detailed would you be able to be in answering those questions?
Right. So how many of you know what your history of your cancer, genetics, ideas of things like that, as well as, for instance, maybe even there's a lot of patients that come to see me that have thyroid disease too. And, I ask questions about if there's a family history of thyroid disease and they just simply don't know, or they may have heard, well, I had a relative that had something with their thyroid, but they don't remember what it was.
Yeah. So I think this is an important topic, and we've actually had it come up pretty recently with a patient who was talking about our medical history questionnaire, which is, it's a functional medicine questionnaire. So it is very in-depth. It asks a lot of questions about family history. And basically they said that they had to go and start asking questions, and that they actually found out a lot of things that they had no idea about. And this person was in their 30s. So, that says a lot about what kinds of conversations that we're having in our families and how we share this information. And I think it's very much a change in culture of what we used to have. When I was growing up, we didn't really talk about mental health at all.
Right.
And that is a lot more prevalent today. I mean, I know that I handle the mental health conversation with my kids much differently than my parents did with me. Right.
And, genetics is a pretty important influence to our health history. What has happened in your grandparents or the, great-grandparents, as well as your own immediate family. So those things are important to determine, well, is there certain types of cancer screenings that I need to maybe be aware of, or certain types of cardiovascular disease that I need to be aware of to know how I need to conduct myself, or what I can do to avoid certain things or to change the outcome.
Yeah. The other thing too is oftentimes genetics, so backing up just a smidge, genetics is just kind of giving us an idea of things to be aware of. Your genes are not your reality. A lot of times your genes can say one thing, and the way that you handle your life, what you're exposed to, and those environmental things are really what will either create those. So where I was going with that initially was, if we know that you have a family history of really any type of cancer, but specifically those cancers that have early detection screenings, you would be starting those earlier than if you didn't have a family history.
Or, be aware of the fact that if you do have heart disease, well, maybe I need to be more proactive with exercise and, avoid certain foods, or change my lifestyle that could delay or even avoid the inevitable outcome.
So the other thing that I wanted to address here is that your medical history isn't really limited to disease processes or things like that. Another piece of your family medical history, especially for females, obviously, is menopause, and how menopause went for your mother or your mother's mother. And this is another thing that I believe we've been very lax in getting the information passed down generationally. I think that a lot of folks don't have those conversations. And when you do think to ask those questions, it may be past the time when your mom can really explain those things to you. So a lot of things we were just made to think that's just how it is. This is just what it's like to get older or to go through menopause. This is just how it is. And not knowing that there really are things that we can do and we don't have to suffer, so to speak.
Right. Yeah. Because I mean, the average age of menopause is 51. So it ranges anywhere from the 40s to the 60s. So menopause can start about any age, and women will have variations in different types of symptoms related to that.
Yes. So menopause is one of those things that definitely can be part of the question. And most of the time, people don't really see that as part of their family medical history. I think the other piece is the mental health question. And there are mental illnesses that are hereditary. Some of those are autism, ADHD, bipolar, major depression, or schizophrenia. And then there are other mental health issues that could stem just from environmental. If you live in a family where addiction is prevalent, then that could be a learned coping mechanism that we need to be aware of, so that, you can work through that, find different coping skills. So mental health is a big thing that needs to not be skipped over when you're having these conversations. And I think that it is really helpful to have these conversations. And oftentimes we find out that we aren't alone in our experiences and our feelings. So.
Right. And so, well, how do we have these conversations? How do we initiate them? How do we have these conversations and sit down with our family members to just start talking?
Yeah, I think the best thing is to come from a place of curiosity. Health issues, whether they're physical, mental, whatever, can be delicate. And sometimes people have a hard time talking about their experiences. And I think if you come from a place of curiosity and, make sure that your family member knows that this isn't a place of judgment or anything like that, I think that you really can spark these conversations and get people feeling comfortable. And it really is going to be sharing of information both ways. So not only is it important to hear what your parents' experience were, but it's also a good idea to share your experience with your parent, because, especially in our situation, obviously we are going to be having these kinds of conversations with our kids, and hopefully we get to a point where that is the norm, where you're sharing those things.
Right. And, these types of open conversations can also spark, that family member to think about their own health. It's like, I guess I do need to go in and get that colonoscopy done, or I do need to have that mammogram done because, Aunt Sally or Uncle Tom had this or that. And so you can actually get them to start thinking about their own health, as well as you can be more aware of your own.
So as we were talking about this idea of starting conversation around health history, we thought it might be helpful to have a little questionnaire / conversation starter that you could use. So we've created one of those for male and female, and along with a table where you can kind of keep track of the answers that you find out, so that you have that and can, answer those health history questions when they come up.
Right. So, if you have an interest in that, just wanting to initiate your own conversations in your own family and just be more aware. You can you can go to our website at revelationhealthofwellbeing.com and just, contact us, and we can provide you to a link for that information and those questionnaires and kind of initiate your discussions. And that way you all can have more of an open healthcare knowledge.
And we'd love to hear about your experiences, whether it's about how the conversation went or ways that you have learned to share your health history with your kids.
So we sure appreciate you listening in, and I hope you've learned a little something, gained a little insight. And at this point, we'll hope that you can have more health and more knowledge and determine to what you need to do to take the next steps. So we appreciate you joining us today.
Have a healthy day. Thank you for tuning in to another episode of Rev Up Health. We hope you're leaving with some valuable insights to supercharge your health journey.
Don't forget to follow or subscribe to Rev Up Health wherever you listen to your podcasts. And if you enjoyed today's episode, please leave us a rating and review.
Have a topic you want us to explore? Reach out to us on social media channels. We love hearing from our wellness community.
Until next time, keep thriving, and remember, your journey to health is a journey to a better you.
Stay well, and we'll connect with you again soon. This is Tandi.
And this is Dr. Mark, signing off from Rev Up Health. Take care.
The information provided in this podcast is for educational purposes only and is not intended as medical advice. The content is designed to support, not replace, the relationship that exists between a patient and their healthcare provider. Always consult with a qualified healthcare professional before making any changes to your healthcare regimen, including diet, exercise, or treatment plans. The views and opinions expressed in this podcast are those of the hosts and guests and do not necessarily reflect the official policy or position of Revelation Health and Wellbeing.